Hello, so what I want to talk about today is passive movements. So movements um, performed at a joint by either an external force or a person. So there's no voluntary or active muscle contraction during these movements. Two types: physiological. So physiological would be movements like flexion, extension of the elbow. All the kind of normal, what you class as normal movements at joints, and secondly accessory movements, which are the movements that occur intrinsically within the joint that you can't actually see to facilitate those movements. So when I abduct my arm out to the side, actually inside the joint, my my humeral head has to glide inferiorly to stop it just carrying straight up onwards into the top of the joint. So those are the two types. Indications for using it could be as a means of just assessing the passive range of motion that somebody's got. Could be for maintaining or improving passive range of motion in a joint, say in somebody that's paralysed, like a spinal cord lesion patient or something like that, or somebody that's comatose, someone who's had a massive traumatic brain injury, who can't move. So maintaining passive range of motion in their joints when they can't do it themselves. What else was I going to say? Yeah, so beneficial physiological effects of this are that it's a good way. I've got Paddy here, he's got a poorly hip, and I don't know if you can see from here, but as I move this leg into flexion, he's resisting me a bit there, and there's a bit of muscle spasm and guarding there. So small amplitude oscillations, so he's not like, okay, all right. Small amplitude passive movement can be a good way for reducing joint pain, reducing muscle spasm and guarding, and also for facilitating the healing process of joints. You get what's called a synovial sweep, basically a smearing of synovial fluid that's secreted from the joint capsule, from the synovium, that helps reduce the friction in the joint and aids cartilage and nutrition. So that's quite a good reason for doing them. What was the other thing I was going to say? Yeah, so the limitations for this are that, one, it doesn't actually improve any strength because there's no contractile element, there's no actual voluntary muscle contraction. It's not going to improve strength, and it's not going to prevent muscle atrophy. So if the person or pet or whatever doesn't actually move the limb themselves, there is going to be sort of a subsequent disuse atrophy of the muscles. And what we'd normally see if you were looking at the passive range of someone's joint, is that the normal restrictions to movement would be things like the muscles, tendons, ligaments, joint capsule, bone, cartilage, all these kind of things. But what I ask you is, what are some of the abnormal restrictions to movement? So out of the ordinary, pathological, if it's not any of those things, what might be limiting a passive range of motion? So that's the question for today. And yeah, that's it for this episode. So catch you all later. Bye.